As Karina said, it's a pleasure for us to be back in Beijing with you in person again this year. As she also mentioned, it's a very exciting time for the journal at the moment because November of this year marks the 20th anniversary of the journal. And it's also an exciting time in the field of cardiovascular research and clinical cardiology. To mark the 20th anniversary of the journal, we published an editorial, and this is an extract from it. And we noted that it's a time of fast-moving change with the advent of, for example, nucleic acid-targeted therapeutics, many applications of artificial intelligence, the promotion of a healthy cardiovascular exposome, personalization of medicine, and the recognition of the importance of diversity, equity, and inclusion in healthcare. And I'll be picking up on many of these themes in the articles that I highlight from the journal that we've published over the past year. So for the 20th anniversary of the journal, we decided to publish a focus issue on the theme of atheroimmunology. That is the role of the immune system in the initiation and development of atherosclerosis, because we felt this was a very important and fast-moving topic in the field. And this focus issue included a comment article to introduce it, and then 5 different reviews focusing on various aspects of this field. And these looked at the role of the complement system in atherosclerosis, the role of efferocytosis, the link between autoimmune diseases and atherosclerotic cardiovascular disease, and then 2 reviews that looked more at the potential for treating this aspect, so the role of specialized pro-resolving mediators and the potential to target immune cell recruitment. And I'll talk about some of these articles over the next few slides. So to start off with, we had a comment article that introduced the focus issue, and this was to do with keeping the immune system in check in atherosclerosis. So atherogenesis involves a complex interaction between innate immune system, the adaptive immune system, and the resolution of inflammation. And it's particularly timely at the moment because the first anti-inflammatory and pro-resolving approaches which attempt to resynchronize the immune system and to treat atherosclerosis are beginning to enter the clinic. One of the review articles in the focus focused on the role of efferocytosis. So this is a highly regulated process through which diseased and dying cells are engulfed by phagocytes for clearance. And it's also known that efferocytosis is impaired in atherosclerotic cardiovascular disease, and this leads to the accumulation of apoptotic and necrotic tissue in the plaque. The authors of this review explain that the mechanism of programmed cell death influences the capacity of phagocytes to perform efferocytosis, and then they go on to discuss a promising therapeutic strategy, which is to target the CD47 pathway with anti-CD47 antibodies, and this might help to attenuate atherosclerosis and cardiac fibrosis. Another of the reviews, as I said, focuses on specialized pro-resolving mediators, or SPMs, as a potential therapeutic strategy. The resolution of inflammation is an active process, and in part it's regulated by these SPMs. SPMs are a superfamily of signaling molecules that initiate anti-inflammatory and pro-resolving actions and stimulate phagocyte function. And SPMs have been shown to be protective in animal models of cardiovascular disease, including atherosclerosis, myocardial infarction, and heart failure. However, clinical trials are still needed to test whether increasing the levels of SPMs in humans can prevent the progression of atherosclerosis. And a third review in this focus issue looked at the potential to target immune cell recruitment in atherosclerosis. So we know that atherosclerosis is driven by the recruitment and infiltration of pro-inflammatory leukocytes into the subendothelial space of arteries. And the inflammatory response is coordinated by an array of cytokines and chemokines, which can potentially be pharmacologically targeted. However, there are challenges which include the lack of tissue specificity and the insufficient selectivity of some of these inhibition strategies. And the authors also note that circadian rhythms in leukocyte migration patterns is an important mechanism and one that should potentially be considered when devising clinical interventions to target leukocyte recruitment. Another important theme of many of the reviews that we publish in the journal is that their focus on the epidemiology of cardiovascular disease. And we believe that in order to address the increasing burden of cardiovascular disease on healthcare systems around the world, we need an in-depth understanding of both the incidence and the prevalence of cardiovascular risk factors and the various forms of cardiovascular disease in different countries and regions around the world. And you'll hear more about the epidemiology of cardiovascular disease in China in some of the other talks in this session. So we've published a few articles on this theme over the past year, and I'd like to highlight some of them now. So one of them was on the global epidemiology of heart failure. So as you probably all know, this is a major global health concern with an increasing prevalence that's being driven by aging populations and better treatment outcomes and improved survival. So we have data from Europe and North America that indicates a decline in the age-specific incidence of heart failure with, as my colleague Karina said, a notable shift towards the diagnosis of heart failure with preserved ejection fraction, especially among women, which highlights the evolving epidemiology of this condition. The incidence and prevalence of heart failure and mortality from heart failure are higher among Black individuals than in other racial or ethnic groups. And there are also geographical disparities in the epidemiology of heart failure and also on the data that we have. Especially, we've seen there's a deficit in the data from Africa and South Asia, which limits the development of targeted healthcare strategies, public policy initiatives, and interventions from these regions. We also published a review looking at the epidemiology of cardiometabolic health in Latin America and strategies to address disparities in this region. So increased urbanization and rapid population aging in this region, together with reduced socioeconomic conditions and inequities, result in poor cardiometabolic health. The increasing prevalence of cardiometabolic risk factors in Latin America and the Caribbean indicates the importance of public health policies to counteract these trajectories. And the authors note that strategies to combat the cardiometabolic disease epidemic in this region must be guided by high-quality local data and focus on evidence-based, population-wide and individual-based strategies tailored to the local context. And also on this theme, I'd like to highlight an article that we published recently in association with the Asia Pacific Heart Rhythm Society meeting that was held in Australia in September. And this focused on the burden of atrial fibrillation in the Asia Pacific region. The burden of atrial fibrillation is increasing worldwide. However, most of the existing data are from Western regions. But according to new analyses performed specifically for the journal's sponsored session at this conference, the estimated absolute prevalence of atrial fibrillation in the Asia-Pacific region in 2023 was approximately 80 million, which is much higher than has been calculated for other global regions. For example, it was 9 to 14 million in the European Union and 6 to 12 million in the USA. And China was estimated to have an AF prevalence rate of 23 per 1,000 of the population and an absolute AF prevalence of 32.8 million, which is the highest in the Asia-Pacific region, which highlights the importance of this arrhythmia and the need for strategies to combat it. Another theme to many of the articles that we publish is that they relate to the UN Sustainable Development Goals. So this is a set of 17 goals that have been set by the United Nations for sustainable development by 2030. And we're proud that over 50% of the articles that we published in the journal in 2023 related to one or more of these 17 goals. I say a lot of the articles highlight these goals, but I'm going to talk about just two of them in the next couple of slides. So the first was about the importance of environmental sustainability in cardiovascular practice. So we know that cardiovascular health and environmental health are linked, and sustainable cardiovascular care is crucial to reduce emissions and pollution while improving health outcomes. Cardiovascular care has a large environmental footprint owing to high energy use and waste from devices and procedures. But the authors note that the footprint needs further quantification. And there are various strategies such as energy efficiency, renewable energy, waste reduction, disease prevention, innovation, and circular economy principles that can be used to reduce carbon emissions and costs. Another of the reviews that we published looked at the importance of soil and water pollution and how they are linked to cardiovascular disease. So eco-disruptive causes of soil and water pollution include deforestation, climate change, airborne dust, over-fertilization, and unhealthy city designs. Pollution by heavy metals, pesticides, and micro-nanoplastics can cause cardiovascular damage. Exposure to chemicals such as heavy metals, solvents, dioxins, and pesticides cause cardiovascular disease. And the authors quantify that degradation of the soil threatens the health of at least 3.2 billion people. That's 40% of the global population. And as many as 2 billion people live in water-stressed countries, which is around 25% of the global population. And they also calculate that illnesses related to chemical pollution of the soil, water, and air are related to an estimated 9 million premature deaths each year, which equates to 16% of all global deaths, and about half of these are of cardiovascular origin. Another theme of the articles that we publish is that they relate to diversity, equity, and inclusion in cardiology, and this is a really important theme to the innovation and success. But the current culture in cardiovascular medicine and research is often not supportive of diversity and collaboration, and this can limit career opportunities for women, working parents, and individuals from ethnic and other minority groups. I'll talk about a review that we've published in a moment, but I'd also like to highlight a couple of comment articles that we have coming out very shortly to do with the use of language in cardiology. One of them is about improving English proficiency for scientific communication in non-native speakers. And the second is relating to unlocking excellence in healthcare and the power of inclusive and sensitive language in medicine. So I'd encourage you to look out for these two comment articles that we published in the next couple of weeks. So one of the reviews that we've published in this theme looks at the importance of sex-related similarities and differences in the response to heart failure therapies. So we know that there are sex-related differences in anatomy, physiology, pharmacokinetics, pharmacodynamics, and psychosocial factors, and that these influence the response to pharmacological agents, device therapy, and cardiac rehabilitation in patients with heart failure. So, for example, in patients with HFpEF, women derive greater benefit than men from treatment from angiotensin receptor neprilysin inhibitors and spironolactone. And the optimal doses of RAS inhibitors and beta blockers might be lower in women than in men, whereas adverse effects might be more common in women. Women with left bundle branch block derive greater benefit from cardiac resynchronization therapy at shorter QRS duration. And women with heart failure might derive greater benefit than men from cardiac rehabilitation, but they have lower rates of enrollment and adherence. I'd like to highlight a collection of articles we've brought together from across the Nature Reviews portfolio, and this is on the role of artificial intelligence in healthcare, and it includes a number of articles that we've published in our own journal on cardiology. So, for example, these include the use of artificial intelligence in imaging of vulnerable atherosclerotic plaque, the role of AI-enhanced electrocardiography in cardiovascular disease management, applications of AI in cardiovascular imaging, and the potential integration of novel monitoring devices with machine learning technology for cardiovascular management. And there's a link to this collection from our journal homepage. I'm just about out of time, but in my final few slides, as my colleague Karina said, I'd just like to highlight that we don't only publish review articles, we also publish evidence-based clinical guidelines, consensus statements, and roadmaps in the journal. So over the past year, we've published a clinical guideline from the World Heart Federation, and these are guidelines for the echocardiographic diagnosis of rheumatic heart disease. We published a consensus statement from an international group of experts which looked at clinical and subclinical acute brain injury caused by invasive cardiovascular procedures. And we also published a roadmap on the standardization and clinical applications of retinal imaging biomarkers for cardiovascular disease. And this arose from a workshop organized by the National Heart, Lung and Blood Institute in the USA. So thank you very much for your attention. I've highlighted just a few of the articles we've published over the past year. There are many more, of course, available through our website. And as Karina said, please do use any of these methods of getting in contact with the journal if you'd like to know more. Thank you very much for listening.